when you're staring at those couple minutes, they're every minute's 20 minutes.
I was looking at the hardwood floor on what's displaying right now.
That looks great.
Well, it looks like we've got 12 attendees. I know there was another community meeting on the west side this evening. There's a debate tonight, but not yet. So hopefully we'll get a few more trickle in. All right, well, it is 5 o'clock. And if everyone can stay muted, hear a little bit of feedback. We'll go ahead and get started. So this meeting is now recording for posterity's sake and those who couldn't join us. So welcome everyone. Thank you for making some time for us this evening to join us in this unsheltered virtual town hall meeting. And yes, it is a little bit of a semantics. We are talking about homeless tonight. And so appreciate your participation. We have some great presentations lined up for you to really showcase and educate what the city is doing, perhaps what the city can't do, and then what our wonderful resources at the county can help provide as well. So let me jump right into it. I do want to recognize we do have several council members also joining as attendees, and we appreciate them joining in on this. And we'll go ahead and jump into it then. So I am the city manager, Tim Ogden. I've been here about 9 months. I'll have a brief introduction, comments, and then I'll turn it over to Police Chief Tom Hansen, and he'll be joined by Captain Doug Silva and Sergeant Chris Peart. And then we'll turn it over to Lavonna Martin, who's the Director of Health, Housing, and Homeless Services at Contra Costa County, and has a brief presentation. And then Dr. Suzanne Tavano, Director of Behavioral Health Services, also from the county. So both sharing perspectives on health and housing, and as well as behavioral health. And so between all of those categories and topics, we should be able to cover much of the issues that we'll talk about tonight. Obviously, this is perhaps an introductory forum. We won't solve the homeless challenges tonight. And I know there may be some concern on both sides of the spectrum of how this population is addressed. And we're going to find something right in the middle, show some compassion, but also some firmness on how we do conduct business here in Brentwood a little bit. So I encourage you to keep your PC or phone on mute. There will be a question and answer period towards the end. We'll try to say 15, 20 minutes at the end before 6 o'clock. Go ahead and raise your hand if you have a question or a comment, and we'll turn it over to you. I believe the chat feature is also enabled at some point where that would be appropriate once we've conducted these presentations. So I'd like to first share just a few insights. When we talk about homeless or unsheltered, the Housing and Urban Development Department at the federal level defines homelessness as individual or family who lacks a fixed, regular, or adequate nighttime residence. So meaning that their nighttime residence is not a place meant for human habitation, or they're living in some kind of shelter that has a temporary living arrangement. And so at least we're all working from the same definition as we talk tonight. What the unsheltered or homeless isn't, however, is that these are not others. These are not some other kind of breed of people. A lot of times people want to be derogatory to this population. It really affects every city across the nation. Brentwood is not unique. Every race, age, gender, etc. is impacted and affected. And many of those who are in our community specifically are also local to here. They grew up here, they live here. I'm getting some messages. People can't join from their phones. Let me pause for a second, see if there's. I don't see that we have phone number set up for this. I didn't realize that was an option. So it looks like this is the only way to join. But there are no others. So we're all in this together. We're all part of the human family and need to show respect for the law where it's being broken, but also respect for those who are struggling with some issues a little bit outside of their control, at least at the moment. And that's where the county is a great steward in assisting in this effort. I'd also like to just share briefly a personal experience to give some context for why I approached this issue. My dad lost his job, left the Air Force, and struggled to find other employment when I was about 13, 14. And we were living in Texas at the time. We shortly thereafter foreclosed on the home. If I remember right, we stayed in the home a few months after it had foreclosed and should have been out of there before we were evicted. Went to live with my uncle in his home in Arizona, finished the last 3 or 4 months of, I believe it was 8th grade at the time, and then exhausted our welcome there, moved up to Canada to stay with my grandparents for a couple weeks, till again we exhausted being welcomed there. Went down to Washington State where my dad had a cousin, stayed in her house, slept on couches, slept on floors. There were a couple times where we actually slept in the station wagon driving between these locations. So I guess technically was homeless for a night or two. And then also stayed in an RV on somebody's front yard for about 2 weeks. A member of the church that we met and hosted us till we, again, were out our welcome there. So my dad finally got employed. We got our own home again. But I learned a few things. One, it's a challenge when you are now homeless with no real prospects of finding another home or a job. But I also learned from my own perspective, introspection on this, that I'm going to work like the devil to get a good education and try to protect my own self-interest as best I can, avoiding addictions, anything else that may cause some trouble with becoming homeless. And so I can see both perspectives, how challenging it is, but also recognize that now as city manager here, we don't have any tolerance for crime or littering or panhandling, those kinds of things that are socially unacceptable, and we will encourage compliance where possible in those kinds of matters. Wanted to give a little context for a big challenge that's facing a lot of the cities and county. This was a challenge that was being litigated, finally went to the Ninth Circuit Court of Appeals, and they came out with an opinion in 2018 that said criminalizing sleeping, sitting, or lying in all public spaces when no alternative sleeping space is available violate the 8th Amendment. So that's a real concern that some of the ordinances cities had throughout the West Coast, at least in the Ninth Circuit Court of Appeals area, were violating the 8th Amendment. They did, however, say that this opinion in no way dictates to the city that it must provide sufficient shelter for the homeless or allow anyone who wishes to sit, lie, or sleep on the streets at any time in any place. So it seemed to provide some flexibility with some reasonable ordinances in place. But the end result was that if you don't have sufficient shelter and bed space in your jurisdiction, you can't enforce it on certain members of the population beyond that number. We don't have any shelters in Brentwood, so this would be increasingly difficult to enforce. I did want to highlight, however, there was a dissent from one of the justices that mentioned that this case, this reasoning, will soon prevent local governments from enforcing a host of other public health and safety laws, such as those prohibiting public defecation and urination. So hopefully you're getting a little bit of the sentiment of what some of the legal challenges are that are out there because of some of the court's decisions. And we're working within the confines of what we can reasonably. In January of this year, the county did a point-in-time count consistent with HUD regulations and an army of volunteers. And this map reflects several points of where they identified sheltered and unsheltered individuals in the community and came up with a count of about 80. And they'll explain when they have their opportunity for presenting a little bit about the methodology briefly behind it. But I wanted to point out that a lot of times we get questions about this area here on this quadrant of the map that is actually in Antioch. And so I want to make sure, at least for the audience here, that any unsheltered issues that are being visible and concerning to the community that are outside in this area, and that's just behind the target area, is actually in the city of Antioch. In another areas where we have identified homeless individuals, a lot of these are in locations where it's a Caltrans right away, or it's a flood control district, or a regional trail property. So that makes some of the enforcement sometimes challenging. But a brief highlight of some of our local efforts: we have regular police officer contact with approximately 38 individuals that they know well, know their issues well. Most of these identify having mental health and addictions. We provide all of them county resource info, and they're encouraged often to get help. We remind them, this is no place for you, you're better than this. Please let us help you. The chief and I happened to tour about 10 locations just last Friday and met maybe about 10 individuals and got to see how much we do care about these as individuals, but also very, very forceful and motivating to say, please, we'll drive you somewhere right now and go get some help. And that's a continual effort by all of our police officers to really try to be a part of that. We work closely with CORE and the MHET teams, and we'll talk about more about those later. And our police department works often with our business and residential property owners on ways to protect themselves, to reinforce things, how to contact these resources and get help and encourage help. In fact, the chief and I have a meeting in a few weeks with all of the major stakeholders in the community, businesses and major property owners, commercial centers, to talk about some opportunities to better address these kind of issues. Briefly, here's a list of some of the municipal code violations that we are often contacted about. And most of these we can still work with and help with and enforce. There's a few of these that are now complicated a little bit by that Ninth Circuit Court of Appeals opinion. So I won't go into much detail on these, but did want to highlight that as you consider reporting these municipal code violations, we have a great resource in this Brentwood Connect 24/7. And this is a great database where it is able to send your concern or complaint directly to the staff member who's assigned to that responsibility. It also helps us track trends and patterns and be able to properly allocate resources accordingly to geographical issues and those kinds of things. Where it's a little more serious, we encourage you to use the non-emergency dispatch number. Often our city council members are the first point of contact to be emailed, and not complaining about it, but just want to point out where sometimes that's going to create some delay. The council members will get the emails. They'll then send it to me. When I get around to it, I then send it to the department head or the staff member, and then they can then respond. The best way is really just to use this app, which you can also download on your phone. Go to our website, just Google Brentwood Connect 24/7. You'll get there, and help us help you get prompt responses to some of these concerns. Also just released in the last half hour, a new web page. You'll find a link to it off of our homepage, Unsheltered Resources. It will be housed under the police department web page. And on this page, you'll find a bunch of different resources, including some of the resources from this presentation, to encourage your neighbors, your friends, how to get better educated and informed on some of the issues, what we can and can't do. And we'll be adding and repopulating that website over time as more information is available. So with that, I want to turn it over to Police Chief Hansen and his staff to fill in the gaps of what I've presented on and provide some more information. Chief?
Thank you, Tim. Good evening, everyone. Thanks for attending this. This is a very important issue for the community. I just want to let you know that there isn't a day that goes by that my command staff and myself don't discuss the issue of homelessness in our city. Like Tim said, they are part of our community, and I understand that, and I take it very seriously. Captain Doug Silva and I, before COVID hit, we would make it a point to go out and contact every single one of our members of our community and really plead with them to get some help. We were successful on a couple occasions, only to find out a month later that these folks were back out in the elements. As you all know, it gets cold and it gets rainy in the wintertime, and I don't like to be driving home to my warm house thinking of portions of our population out there unsheltered. As far as you know, a lot of this falls under the police department, so we have designated a homeless liaison officer, and I can tell you that this issue he works on, probably half of his work week is on homeless issues and going out with outreach, not only meeting with our population that are unsheltered and suffering from addiction and mental health, but also meeting and teaming up with our county partners who offer a lot of the resources in our county to help assist these folks. So I just want to say that this is something that we take very seriously, and we try to manage it as well as we can as a city. It's a difficult problem that every community faces. Those of you that work intimately with these individuals, you have my utmost respect, and I want to be here to partner with you and help them in any way that we can. So with that being said, I do want to turn it over to Sergeant Chris Peart, who will give you an update on what we do as a city, since he's our point of contact. So I'd like to introduce Sergeant Chris Peart.
All right, thank you, Chief. Hopefully everyone can hear me well. So as the Chief said, I'm our homeless liaison, and part of my role and responsibility as the department liaison is to engage with the community and then communicate with them. Part of my role as a homeless liaison is reaching out and building that rapport, building those relationships, so they feel more comfortable when I come around and know that I'm not out there looking to take enforcement necessarily, but more to engage with them and provide resources. Now, we've been with this process for a couple of years now, and we worked with many other departments and established a really good protocol on how to address some of these issues. And I also reached out to county services and sought different information that I could add or offer when I do encounter anyone who's homeless or unsheltered. So with that, the first thing I do when I encounter a call for service, there's two ways. As the city manager spoke, we get calls through dispatch. Every single call generated for a homeless or unsheltered issue gets forwarded to me via email. If you decide to use the app, which is also just as well, I monitor the Brentwood Connect CRM apps. So I see it from both sides. I either get a call from dispatch or through the Brentwood Connect. So the first thing I do is I want to go out there and I want to engage with those community members and build that relationship. And the first thing I do is try to figure out where they've been, how I can help and assist, and then offer services. Part of that engagement and dealing with the county, I've built a rapport with their core team, which is I'm sure they'll speak more of it later on, but it's the coordinated outreach, referral, and engagement. And I communicate with them sorry, I'm reading my screen. When I have someone who's intrigued and interested in that service that they provide. So I'll communicate with them. And then I want to work with them. I don't want to just go out there and look for the first opportunity to take enforcement or to take some action against them. I want to work with them and see if we can work with them and get them into shelter or a job and whatever we can do to help them. So, but if it does come to that, we established a protocol that we have in place now to remove them from whatever area they are. So first thing we look at is who has the jurisdiction, as the city manager spoke of earlier. Is it going to be Caltrans or CHP? Is it going to be East Bay Regional Park? Or is it someone's private, some other jurisdiction's private property, such as Railroad, County Flood District? So when we engage one of those, we look to determine if they're violating any trespass laws. And if they do, we've established this protocol where we post a notice to vacate. So we offer all these services. If they turn it down, unfortunately, we take to the next step and we post a notice to vacate on that property. And then we give them 72 hours to collect their belongings and vacate the area. Now, when we return to 72 hours, if they don't have anywhere to store their property, we will also collect their property and house it here at the police department for 60 days. And they have, for 90 days. So they have 90 days to come and collect that property or it'll be disposed of. And all of that's spelled out when I communicate with them. And that's part of the protocol that we've established and we adhere to when we deal with them. And then the next step is communicating with a cleaning company to have them come out and clean up the area. So that's part of our protocol and what we've enacted when dealing with these type of situations. Chief, do you have any other insight, or do you want me to touch on anything else?
No, I think that's good. I just remind people put their thing on mute so we don't have feedback. But I think you hit on that, and we'll be here for questions at the event. Questions.
Great, thank you, Chief and Sergeant. I'll now share my screen and turn it over to Lavonna. Let's see, here we go. Okay.
Good evening, everyone. Thank you so much for having me here today. I've been asked to talk about the homeless system response, particularly in COVID, and what services that we are able to offer, including our core outreach services. So I'll talk a little bit about that today. I have about 10 minutes, so I'm going to keep this as brief as I possibly can, but thorough. I'll start with an overview of homelessness in Contra Costa, as well as specifically here in Brentwood. I'll cover homelessness-related services and housing prior to COVID and what impact COVID has had on those services. I will then turn to talk a little bit more about CORE's role, our outreach team's role in helping persons during this time, services and housing that might have been created in response to the pandemic, and what planning efforts are underway as we look to provide housing and services after COVID. So with that, I will go ahead and get started. Nearly 2,300 individuals were experiencing homelessness the night of our count on January 22nd. Most individuals identified were single adult households, with about 5% households with dependent children. A little more than 700 were in shelters throughout Contra Costa County, but the overwhelming majority, 69%, were unsheltered throughout our community. When we looked at the unsheltered count, and each year when we do a point-in-time count, our objective is to get as accurate information as possible. This year, we used GIS mapping technology and more than 175 volunteers to help us count individuals who are living outside. And this year, with sort of satellite accuracy, we were able to determine which cities individuals were found. This is a picture of our heat map. If you go to the next page. It is a picture of our heat map of individuals that we found on the day of the count. And for the first time in recent history, and I've been here with the county for about 20 years now, there was actually an equal distribution of unsheltered people across the region, with a third found in East Contra Costa County, a third in Central, and in West. Brentwood represents about 5% of the total unsheltered population that were found that day. That's equivalent to 80 individuals who were found. And this is behind, just for context, this is behind the city of Pittsburgh, who is currently has about 6% of the unsheltered population. And Brentwood's numbers are equal to other cities like Walnut Creek and Pleasant Hill. 68% of those who were counted in Brentwood were found in sleep settings, such as vehicles or RVs. And I'll talk a little bit more about that. But 68%, a significant portion, were actually found sleeping in cars and RVs and not found in traditional tents or sleeping on sidewalks or in doorways. Next slide. So when we look at sort of the trends over the years, not only do we look at our point in time counts, which is one night of the year to give us a sense of how many people on any given day are sleeping outside, but we also take a look at the number of individuals who are accessing our system of care over the years. And looking back at the trends for Brentwood, residents that have accessed our homeless system of care over the past 5 years has been growing. And you can see that our latest information for a full year based on 2019, we're about 102 individuals who are accessing our shelters, our outreach services, our multi-service centers or care centers. I also wanted to include a little bit of information of what we're seeing this year, knowing that we are most certainly still very much in the pandemic. And as we continue to see the impact of the pandemic on our community's health and economy, 2020 is most certainly shaping up to exceed last year's numbers for those persons who lost their housing in Brentwood or who will potentially lose their housing who are from your city. Next slide, please. When we look at Brentwood residents who are reaching out for services, we note that the majority of individuals are white with about 55%. And that individuals who are African American or Black are disproportionately represented at 21%, when according to the US Census Bureau, they comprise about 7% of the population. We see that 22% of the population identify as Hispanic origin. You see there Latinx. A third of those individuals report substance use disorder, and nearly 40% reported a mental health disability. Next slide, please. So when we look at what services those impacted by homelessness are utilizing in our system of care, we really have to look at the full network of county and nonprofit service providers that bring together a safety net. We, in our system of care, about 3-4 years ago, really tried to make it easier for individuals who are experiencing homelessness to get connected to resources. And so we typically sort of term that as call care core. You can call 211 to get connected to resources. You can go by a care center to get resources, including showers and meals, and connected to housing resources and shelter. And then there's CORE, which I'll talk a little bit more about later, but that is our outreach services. Our services include in prevention services, which are typically financial assistance to avoid imminent eviction. We also have rapid resolution services in our community, which are really problem-solving programs to find alternatives to persons entering our shelter system, thereby diverting them from the front door. We have emergency shelters, which are time-limited stays in congregate shelters, permanent supportive housing, which is rental subsidies and supportive services to help people successfully stay housed, those persons who have disabilities. We also have housing navigation services in our community that support people in finding and securing permanent housing. And finally, we do have street outreach for individuals who are living unsheltered and living outside in our community. But the way in which services have been delivered has changed in the face of the COVID-19 pandemic. Next slide, please. Because of the pandemic, we've had to change the way in which we conduct some of the work and bring even more resources to persons who can't stay home because a home doesn't exist. This is just a little public health service announcement for you, that please, that we are still mindful to continue to mask and social distance, but all of these things have required us to do work differently in our community. Next slide. We very quickly realized that individuals experiencing homelessness were at higher risk of a negative outcome should they contract the coronavirus. Our PIT data shows that a third were over the age of 55 and 80% surveyed reported at least one disabling condition. Both of these factors put individuals at higher risk of a negative outcome should they contract the virus. So really the county moved very quickly towards the end of March to vacate most of our congregate homeless shelters in our community. And that was simply because those shelters that were often bunk beds and didn't have adequate spacing between the beds. It was really important that we created the distancing that was required to keep people safe. And so the county and its partners moved more than 300 adults and children into nearly 600 rooms secured under Project Room Key, which are hotel rooms for high risk and COVID positive or persons who are waiting for their test results. Who are experiencing homelessness. We have rooms scattered across our community. I'll talk about that a little bit later. Our county health officer also asked all law enforcement to not displace encampments during this time, except in cases of risk to safety. The county also worked with many communities to procure hand washing stations and porta potties. We delivered more than 40 units of hand washing stations and porta potties to better support persons living outside, particularly in the cities of Martinez, Antioch, Concord, Walnut Creek, San Pablo, Pittsburgh, and Richmond, as they really wanted to make sure that they partnered with the county in that initiative. The county also worked really hard, and our core teams worked really hard to distribute personal protective equipment, or PPE, and other supplies. During this time, we've delivered more than 5,000 surgical mask substitutes to 13 homeless service provider agencies. Thermometers were distributed early on in the pandemic to ensure that we were taking temperatures to all of our home service providers to keep staff safe, as well as those individuals who were accessing those services. And also things like gloves and gowns were distributed to our providers who were really providing services in the hotels. But much of this was really distributed by our outreach teams. Next slide. As I mentioned, core teams are really the mobile front door to our homeless system of care. 13 core teams remain operational during COVID-19, and services they provide have been even more critical at this time. They are out providing 7 days a week food support and distribution. To date, they distributed more than 9,500 food packs to individuals. They are continuing to ensure the health and sanitation of those individuals who might be living outside to the best of their ability by distributing hand sanitizers. More than 7,000 have been distributed to date to individuals when there's a lack of water for them and soap for them to do that themselves. Safety and survival supplies like solar battery packs, some of the things that we initially didn't think about but so needed just to keep their phones charged so they can stay connected to their the physicians, their primary care physicians, as well as mental health clinicians, but also just family. And so we distributed 100 solar battery chargers because individuals could no longer walk into a library to charge their phones. Core teams were out there and continue to be out there providing training and education on staying safe, continuing to distribute masks to individuals who are living outside. They are providing encampment displacement supports as communities must disrupt encampments for risk for those health and safety risks. Core teams are out there trying to provide support to individuals, connection to health and behavioral health services for testing, for COVID testing, as well as mental health and SUD services continue. Core continues to provide assessment and direct referral to our health teams for placement into hotels. Next slide. If you aren't already familiar with our core outreach teams, I want to talk a little bit about the composition. The foundation of each team consists of 2 outreach specialists, and all core teams across our system have access to social workers that can assist individuals getting connected to things like benefits and connections to our housing navigation system of care. The team's reach is extended by our connections across our health department, including our healthcare for the homeless teams, who really join the core teams twice a week to provide wellness checks and schedule medical appointments. Oftentimes on board, they have a registered nurse or nurse practitioner, community health worker, as well as a licensed mental health clinician to connect people to services. And in partnership with our behavioral health division, who is joining me today on this town hall, our behavioral health division supports the teams as they need. When sometimes we need a psychiatrist who can do medication evaluations in the field, or getting people connected to simply to their behavioral health clinic. As a result, CORE really has made an impact in our community during this pandemic. Next slide, please. When looking at CORE's impact in Brentwood, last year, just as a comparison, CORE connected to 53 unique individuals. And when we asked those individuals their reasons for being in Brentwood, I really want to echo what Mr. Ogden said a little earlier, that a significant portion actually grew up here. 34% said that they grew up here in Brentwood. Another 28% said their friends and their families are here. And then we had about another 28% who just said that they were simply just passing through. CORE was able to place last year 16% of those individuals in shelter. Remember, there are no shelters in your city, and actually very, very few beds in East Contra Costa County. Nearly 40% of those individuals, though, spent at least one night in our warming center. Looking at CORE's work during the pandemic, and that's really March through August, 84 individuals were contacted, so already exceeding the numbers that they connected with in 2019. During this short period of time, 84 individuals have been contacted. And CORE, a really big role is connecting individuals into the emergency hotel program. And CORE was able to place, of the 18 individuals that were placed in the hotel program, 14 of those individuals, 78%, were actually placed by our CORE teams. Next slide, please. Going a little bit deeper into our emergency hotel program, as mentioned a little earlier, Contra Costa leased nearly 600 rooms under Project Roomkey, and the nearest hotel in East Contra Costa County, or nearest to Brentwood, is a hotel that we've leased in Pittsburgh that has 166 rooms dedicated specifically for consumers. Our utilization rate across all of our hotels is steady at 99%. So we have reached capacity, and we've reached capacity for those who, again, are at highest risk. And 18 of those persons that have been served to date are from the city of Brentwood. Next slide, please. So when we think about how we continue to serve those persons experiencing homelessness now and after COVID, we must keep a few things in mind. One, how do we continue to provide services that keep the population and community and staff safe? And so we're looking at things like, what does it need to continue to do place-based services versus mobile services, or implementing things like telecase management? Two, how do we keep some of the gains in bed capacity that we made, especially in East Contra Costa County, which has only had 20 beds, shelter beds, prior to the governor's emergency order? How do we keep some of that capacity in our community where it's so desperately needed? And finally, And even more importantly, how do we accelerate placement into permanent housing that's affordable for our consumers with the services at the level they need in which to remain housed? As we know, the long-term solution to homelessness is really housing. And so how do we stay focused on that and accelerating placements from individuals from emergency hotels or emergency shelters into permanent housing? Next slide, please. So to that a bit, as going a little bit back to how do we maintain some bed capacity that we gained, we want to think about how do we prevent the more than 600 persons that we currently have in our emergency hoteling program from returning to the streets once the pandemic is done. And even though we don't know when that is, we do need to be thinking about what does that look like in our community. And when we look at traditional emergency shelter inventory that is available, it is important to acknowledge that in Central County, there are more than 150 beds of traditional shelter that already exist. And in West County, there's even more, there's double that, more than 300 beds in West County that are able to accommodate many people who may currently be in hotels, who might need to transition at some point. But in East Contra Costa County, we have more than 200 individuals currently in a hotel, and we only have 20 beds currently in the entire region. So when the governor announced that home key funding opportunity was available, it was really an opportunity to think about how we keep the beds and services that we desperately need in East County in our community. And some of you may recall that development of a shelter program and care center was the #1 priority that was requested during our community process that was held in late 2018. And since that time, we've been really dedicating a lot of resources to make that a reality. So when the governor recently announced that our application for home key funding was successful, we really now have the ability to make that vision of a permanent service hub a reality for those persons in our community. Next slide. I want to just end by pointing to additional resources. And so if you're interested for more information on COVID-related information and resources, specifically for persons who are experiencing homelessness, you can go to the website noted there. Thank you.
Thank you so much. We'll now turn it over to Suzanne.
Hi, good evening, everyone. Thank you so much for having me. And I just have to start out by thanking Mr. Ogden for sharing his personal story, because the more we share about ourselves, the more humanity we bring to all the work that we do. So thank you so much. I think it really highlights that experiencing mental illness, experiencing addiction, experiencing homelessness is not, it's an equal opportunity kind of event. And people in all walks of, from all walks of life are encountering all of these. And would also say right now during COVID, we know that people are continuing to lose their jobs. When they lose their jobs, they lose their health insurance. When they lose their health insurance, they oftentimes go on to Medi-Cal and become Medi-Cal beneficiaries. And it's a sort of a whole new world for many of those individuals. So wanted to just make that general statement. And then also, I think oftentimes there's the chicken or the egg discussion that goes on. Does being homeless, unsheltered, cause mental illness and or substance use, or the other way around? And I think what we would say is everything. And the solution is not looking to what came first or second, but looking to address both and all of these complex issues at the same time, or we don't really get to where we want to be. So if we could go, if somebody could start that PowerPoint, that would be great.
I don't recall getting a PowerPoint from you. I'm sorry.
Oh, you want just, I'll resend it. It was sent this morning.
I don't see it. Yes, please send it.
I'm so sorry.
while you're doing that, let's answer one of the questions that we've got so far. So someone asked about the man who lives in the bus stop on Sand Creek by McDonald's. Someone want to tackle that one?
Yeah, Tim, I'll take that. So his name is Bus Stop Donald. He's very engaging, very fun to talk with. I've talked with him on a couple occasions. Our patrol officers have frequently contacted him. He's homeless. He's expressed that he wants to continue to be homeless. I've offered services, tried to pass out pamphlets, and he's respectfully declined to take those, and he enjoys what he's doing right now out on the street. He is at that bus stop, but that bus stop is no longer part of the Tri-Delta Transit route, and so he's not committed any crimes, and so unfortunately we have no authority to move him. I know we continually get calls for service of him, but he's not doing it. He's just sitting, hanging out at a bus stop. So we continue to engage with him. Every time I go out there, I continue to ask if he needs any assistance, and he doesn't. He's very content with his current situation.
Great, thank you.
Yeah.
Let's grab another question here. Is the county reported number of 80, including the camp in Antioch, behind target?
I think we addressed that a little earlier. So the map, the short answer to that is no. It does not include anything beyond or to that target or beyond that target. That is specifically Antioch, and we know that because we actually use GIS mapping software. So wherever that individual, there and outreach teams and volunteers went out to do the count, wherever they were and saw the individual, they simply dropped a pin, and with GIS technology, it dropped exactly where that location was. And so therefore we know with a certain degree of certainty exactly where that location, where that encampment was.
Thank you for answering that. Okay, Suzanne, thank you for your PowerPoint. Here it is.
Thank you so much. I don't know what happened there, but I apologize. So if somebody could advance it, and I'll go pretty quickly, and if we could go to the next slide. So this is a very, I should step back and say that Behavioral Health Services contracts with the State Department of Healthcare Services to manage and provide all mental health services to people who have high need in the mental health area, and also all substance use services to all Medi-Cal beneficiaries. So this is just a very high level view of what we do, with the left-hand side being prevention, early intervention, and those services are open to the community at large. But once you move over to the outpatient services and work your way to the right, all of those services are available to Medi-Cal beneficiaries and also uninsured low-income people. And the way this chart works, it's just a very high level, but it goes from our least intensive services, and then at the very top, you'll see inpatient, which is hospital care and state hospital care, and then how we get people out of those high levels of intensive services. But what I would say is really throughout this continuum, what we're trying to do is help people get roofs over their heads. And in the past, behavioral health services only provided those kind of direct behavioral health interventions. But over the last decade in particular, we increasingly have been investing really millions of dollars in different types of roofs, because we know people cannot maintain sobriety, cannot maintain their mental health if they're unsheltered and living in the street. So our goal, and this is where it really coincides with Lavonna and H3, our goal is that everyone that we're serving have permanent housing. And that's, I put the least intensive because that really indicates that people have a roof over their heads. They're living as independently as possible with as many supports as we can give them to do that. And the type of roofs that we're sponsoring might be a sober living environment, an SLE house for people who are in recovery from addictions. And then on the mental health side, you hear of board and cares, and master leasing, et cetera, et cetera. So we feel that if we want our behavioral health services to be fully effective, people have to have a roof over their head. And so we work very closely with Lavonna, and we are always looking for ways to invest even more money into housing wherever we can. So if we could go to the next slide quickly, and the next one, please. So this next one is just, again, a very high level look at all the substance use services now available to Medi-Cal and uninsured people in the county. Up until not that long ago, these benefits were extremely limited because there really wasn't very much state or federal funding for them. But after the Affordable Care Act, it was sort of a whole new world, and we were able to build up a more robust substance use delivery system that starts with prevention and goes all the way through residential treatment. And again, our contracts for sober living environments, the SLE homes, are a very important part of this whole continuum. So we can go to the next slide and probably the one after that. Probably advance 2 slides. I'm not sure if you can hear me or not.
Yes, is this the right?
Oh, thank you. If someone could advance, I think it'll be 2 slides.
Ahead or behind?
Going, I'm so sorry. If we could go back a couple.
Sure.
And I would, there we go. So this is just a more detailed picture of the first 2 that I showed. And these are the services, predominantly the mental health services that are available to all residents in East County. And in every region, we have a large regional clinic, but then we contract with many different agencies to provide services in the community. And for Brentwood in particular, we contracted with Seneca to start a specialized day treatment program for youth with special education needs. And as Lavonna was saying earlier, we understand and recognize the growing needs in East County, and we are working very diligently to increase our presence there. So these are all of the services that are available to adults that live in the eastern part of our county. And then if we go to the next one, there'll be a similar map that reflects all that we're doing with children's services. Well, we skipped over it, but that's okay. There's a similar map for children's services as the one that I just displayed. There we go. There's children's services. And as you can see, is a pretty broad array. Many of them are located within East County, and then others are available countywide, and East County residents can access them. So if we go to the next slides, and I'll go pretty quickly so we have time for, yeah. So if we go to the mobile crisis teams, we have 3 different mobile crisis teams. The first one is called Mobile Crisis Response Team. That's available throughout the county, and they're teams that will go out and respond in the community. There's a licensed mental health clinician and then a peer provider, someone with lived experience who will go out together. Our hope is to, when the mobile crisis response team is activated, to have it be as much as possible a behavioral health intervention, but we do at times request assistance from local law enforcement. I think historically we were really starting out with asking for law enforcement assistance, and that is still the case, but increasingly once the situation is determined to be fairly stable, then law enforcement can move back and the mental health clinicians can pretty much take over. And what our hope is that increasingly we'll be able to provide more response with as little dependence as law enforcement as possible, because we know law enforcement is very busy with many, many other things going on at the same time. So that's the Mobile Crisis Response Team. It's available throughout the county. And what I would say is that for East County, about 46% of all of our calls to the mobile crisis response team are coming from East County. And for Brentwood in the past year, there were just under 40 of these calls and 40 of these responses. So if we go to the next slide. So this is the mental health evaluation team. This was mentioned earlier in the presentation. And this is a very different model because it pairs a mental health clinician specifically with a police officer. The police officer primarily is identifying high need people that are coming to their attention, and then contacting the clinician and then doing interventions together. And I would say that historically, we were doing all of this work in the community when we went into sort of the shelter in place phase of COVID. We pulled back and we're trying to do as much as possible remotely. We continue to do that, but we realized to be a mobile crisis response effort, we have to be there in person. So our teams are now appearing in person increasingly, and our goal is to keep building on that. So that's the mental health evaluation team. And then we have a third program that's the mobile response team. And we contract with Seneca to operate this team. It's been in operation for many years. And I particularly like this model because this is probably the intervention type that is least dependent on law enforcement. Again, we know that the police and the sheriff are very busy with many things. So we're really trying to move to being able to intervene as much as possible more independently. The mobile response team that's been around, honestly, for I think over 14 years or more, is composed of all mental health clinicians. They are working almost independently the great majority of time. The only situation in which they would call for support from law enforcement is if it appears that a person is in really acute distress and needs to be placed on an involuntary hold and taken to the psychiatric emergency service. It's interesting looking at the numbers. And everybody, please excuse me. I just had surgery, so I'm still recovering and I lose my voice a lot. The mobile response team, when we look at the data countywide, actually Brentwood comes in sort of sixth place in the number of calls for a mobile response team. So I'm really happy to see that because this is youth oriented. So it's to go in, meet with the youth and their family, where they live, really assess the situation, and then determine what the next best steps are. And the goal really is to divert from a 5150 and divert from hospitalization. And then there's follow-up care that occurs after the initial contacts. So I really would stop there at this point. This is some additional data that breaks down the mobile crisis response team calls by city. So you can see the breakdown. And East County is on the leading edge for frequency. If you could go to the next one. And again, this is just more data on the mobile response team. And you can see there that Brentwood comes in around number 6 with about 20 calls. So we find that East County is making use of these services, which we're very happy to see, and we want to continue to provide those supportive efforts. So that's the end of my little presentation, and I'll stop there and then be available to answer any questions. So thank you so much.
Thank you, Dr. Tavano, especially since you are in your own healthcare here.
It's okay. It's good. Thank you.
Okay, well, if everyone's okay for a few minutes longer, let's see how many questions we can attack here and answer. I don't know where we left off. Let's see. Are the individuals that fall under the concealed homelessness category, I think that was the sleeping criteria, sleeping in cars and RVs, are they making up the difference between 80 reported by the county and the 38 reported by the city that are more visible. I think I had heard, Lavonna, from your staff that about half of the count of the 80 were found in the vehicles, could be mobile. All right, okay. Let's see. Appreciation from one about grateful for the city and the Brentwood PD for their efforts to help these unfortunate unhoused people. The city and Brentwood PD's response to residents' reported incidents have been outstanding, and we'll take this opportunity to thank them. So we appreciate that. Another asked, how best can we increase the number of available beds from 20 to say 200 as winter approaches?
Well, I am happy to say that we are making every effort to purchase the hotel that we're currently utilizing for Project Room Key. If we are successful in that purchase, so I say that because we're still not quite there, but it is, public information that we are trying our best to do so. That will add 174 rooms to our system of care. And really, that would be an almost 800% increase in bed capacity for the East County region. So we are pushing really hard to get that done to make sure that we keep the resource here.
Is that the hotel in Pittsburgh?
That is the hotel in Pittsburgh.
Great. Someone asked, will the council get the same presentation? Some have done interviews and said that the 80 is wrong. I think there's just a difference in methodology we're talking about. So we'll keep it at that. Someone else asked, what are the first 2 or 3 steps we as Sioux Public can do to support the city? So Joe Public, Sioux Public, to support the homeless, to support the county program. So what can a regular citizen do to help support these programs the county is providing?
Well, I think there are actually many opportunities from really just giving of your time. We do have another point in time count coming up in which we do invite volunteers and actually really rely on volunteers who know their community, who know where homeless individuals may be living to really come out, help us count them. So I think that's one sort of low-hanging fruit that's coming up very quickly. So if you're looking for volunteer opportunities, please reach out. You can reach out to me, and I'll make sure you get connected to the right people, up to the point where when I think there's also an opportunity for when there are opportunities to actually bring services into a community or housing into a community. I think often we do hear community members who are concerned about bringing those services in, and maybe we also have a lot of, I know, neighbors who also are very supportive of those things. And I'd say there's always opportunities in your city council and at the city level to go in and say, I really want this for our community. So the next time that there's an opportunity to bring more affordable housing or services into the city of Brentwood, those of you who are supportive of those efforts, your voices are so important to be brought forth.
And and Lavonna, I would just add to that. I think the whole orientation of what everyone spoke to earlier today, and just by the community asking that question, shows so much, because if there's an understanding that people are dealing with such complex issues in their lives, and that there's the will to support them in their journey, it makes an enormous difference.
Well, if it were an easy issue, it would have been addressed long ago, right? There's a lot of complexity to it all. Someone asked about an encampment behind CVS and Safeway Shopping Plaza on 2nd Street downtown.
Yes, I'm aware of that location. I've been out there, I believe 2 weeks ago. I was trying to work with them. I offered services. They took the pamphlets and they seemed interested, but I'm going to reach out to them again and continue those efforts in dealing with them.
Great. Looks like, let's see. I want to make sure I'm not missing any here. A lot of thank yous. When someone refuses to help and we ask them to move, where are they supposed to go? To another illegal place? Do you tell them where it is okay for them to go?
Yeah, so I know there's some discrepancy in our count versus the county, and obviously it speaks to the methodology, but my encounters, it's typically they're refusing because they choose to be homeless and they're content being on the street. So when they do refuse, which is often with me, I reach out to the core teams. I send them an email of their location because they like to come out without police presence to help build that rapport in a different way. But we let them know what's available and just communicate with them and keep that line of communication open.
Okay, thank you.
If I can just add to that, I think one of the really great things about a core team is we know that law enforcement is busy. There's a lot going on, and the core is that constant presence. So time and time as individuals may say, no, thank you, I'm not interested. Really, core is there for that window when they say, now I'm ready. And that is why it's so critical to keep those, teams and keep that engagement going, whether that's through, Officer Peart's, efforts, or whether that's through core efforts or a concerned citizen who wants to just continue to stay connected to that individual.
Yeah, I very much agree. It's hanging in there and trying again and again and again and building some level of trust and having the person willing to engage with what's being offered to them.
Yeah, I attended a homeless meeting years ago and heard from a former homeless person who said it was like the 40th invitation before they finally heard it and said, okay, fine, I'll go get help. And they said, it changed my life. They said, don't give up after the 39th. Keep asking, keep inviting, we need hope. And so that's a powerful message. Someone asked about a homeless individual that was killed. I wonder if that crime has been solved. I don't know if we can answer that one or not. Chief.
Yeah, right now, the work was a hit and run collision that occurred on Brentwood Boulevard, south of Balfour, and our investigations division is still working on some stuff I can't go into as far as the investigation. No, very much on our priority list to solve that. I think it's very solvable case.
Great, thank you. So question for Lavonna, how do you see the city's role versus the county's role? Are cities in our county taking steps on their own to purchase hotels and address the needs within their own city? How can we best partner to build the strongest approach to the growing need?
It's a big question. And I think there's, if I can try to make that as easy as possible, I do think there is a role for us to work together. Because at the end of the day, not every intervention, not every solution is right for every community. And you have to think about what the community's interest, tolerance, sort of what the community makeup is, what looks, works for their community versus another community. So it's something that the county itself can't do it all, because we absolutely need the cities to tell us really will work best for their city. Having said that, we also know that the county, the resources aren't, we don't just have our cup isn't running over. Let's just say that, and that there are real constraints and limitations to what we can do. And so if we're relying only on those resources that we need to spread across the county, then those resources don't go as far unless we are partnering also with cities who can ensure that those resources stay in their community. So sort of that partnership, I think, is critical to advancing those strategies that really work in addressing homelessness. And as I said earlier, really housing is the answer. And that's one of the things that actually is a city function and not so much a county function. And so we must work together so that those interventions too can be developed. And so I I think that's my nutshell. I'll stop there. Suzanne, you have other thoughts?
No, I was just chuckling because it was over a year ago, Lavonna and I were at a board drawing out, why is our system so backed up? And it always comes to ultimately permanent housing, and how do we continually move to having more permanent housing available to everyone? And because that's the ultimate goal for everything that we do, is to have people housed.
And I'll just append that response a little bit, that cities don't build housing, but we can make sure that we properly educate our community, that we're not making it harder for developments to occur, and find a good balance there. The other thing too is cities don't have the same kind of funding sources, as limited as maybe the county. So it really makes it challenging for both jurisdictions to try to address all of the needs that continue to seem to be growing.
Question, Doctor, how many in the shelter in Pittsburgh? That I think Lavonna said it's 99% full. How many of those residents are in?
Are in treatment?
Yeah, some
Yeah.
sort.
So when the hotels were first made available, we compared data to see how many of the original group also were open and known to behavioral health services. And it was a very significant number. Out of that original 500, it was, I think, Lavonna, over 150 or so. And yeah, and those were people that had just been seen by us in the last 6 months, not people that had ever been seen by us, certainly. So we were looking at that slice of time of the prior 6 months and realized how high it was. And that's when we continued to partner more and more to get more behavioral health services into the hotels. And the hotel in Pittsburgh, certainly, we just recently assigned a number of clinicians specifically to support people in that hotel.
Okay, regarding prevention, are there programs that can better support families that are on the verge of losing their homes due to COVID? Support to pay a month of rent, for example. The city doesn't have it. Does the county offer any of those kinds of programs?
Sure, there have been a number of philanthropic dollars that have come down. Silicon Valley Community Foundation has supported our Contra Costa Regional Health Foundation for COVID specific funding to keep individuals and families housed. I would say that you can go directly to the Contra Costa Regional Health Foundation website to find the nonprofit housing providers who receive funding to provide those services offhand. I know Catholic Charities, Shelter Inc. Provided we're granted dollars to help with rental assistance. And so, you can either go there, or the easiest thing, call 211. And they can most certainly provide you a list of all those agencies that are doing homelessness prevention.
Great. Question about how often does the mobile response team visit the homeless in Brentwood, approximately?
I don't have that data in terms of that breakdown about homeless versus sheltered. I can get it for you. I don't know, Lavonna, have you ever heard that number?
No, not for the mobile response team.
That's a good question. Thank you.
Let's see. We know people can refuse help. When they often do, it's due to underlying issues like mental health and drug uses. When is it appropriate, or would it be, for APS to intercede, or for there to be a 5150 call?
So I think there's a lot of thinking that goes on about 5150s. And so if I could just say a few words about that. So as you on the panel know, police officers and sheriffs and park rangers, et cetera, deputized people are able to initiate 5150 holds. And then in addition, as the local mental health director, I can designate licensed clinicians to initiate 5150s. When do you initiate a 5150? That is a very difficult thing to say, because in the end, once a person is placed on a 5150 and brought to a psychiatric emergency services, they're going to be evaluated based on three outstanding criteria. Are they a danger to themselves? Are they a danger to others? And are they gravely disabled? And gravely disabled, food, clothing, shelter. But it gets pretty, it's not clear when it comes to people who are living on the street and are unsheltered. And so the 5150 often is initiated, but it does not always lead to hospitalization. It basically gets the person to the facility to be evaluated for whether or not hospitalization is necessary. And it's a pretty high criteria for involuntary hospitalization. And I think there's also a little bit of misunderstanding when people are placed on a 5150 and are taken to psychiatric emergency services, PES at CCRMC. The assumption is that they will stay there for at least 72 hours because that's how long a 5150 hold is good for. But it doesn't mean that they will necessarily be held for that amount of time. And I think that creates a fair amount of misunderstanding in the community also. And so many of the police officers in the county have gone through CIT training, specialized training in how to intervene in the community and help better assess when a 5150 is indicated or not. So I would add that piece also.
Yeah, Suzanne, you did a great job articulating that. I would also add that our department, every single one of our officers has some portion of the CIT training, and we evaluate everyone on a case-by-case basis. And if we believe that that's an underlying issue or something that needs to be addressed, we do work with the mental health evaluation team, and we have a liaison at our department who is in direct communication with that Pittsburgh officer and can summon whoever we need out here to evaluate anyone anytime, day or night.
Very good. Are we okay on 2 or 3 more questions on your time, Suzanne?
Sure.
Okay. Let's see. There's a question. It was to kind of follow up on something they thought they heard. Did you say earlier that 18% of the Brentwood homeless are staying in the Pittsburgh facility? Was that said earlier?
18 individuals have been placed in our hotel system. I do know most of them are in the Pittsburgh hotel, but there may be others in other hotels that are in Concord and or Richmond.
Okay.
You know, if I could add a comment, one of the big learning lessons once the hotels were opened and people were moved into them, I'll say from the behavioral health perspective, many people that for a long period of time we've been trying to outreach and engage with and just not being successful when they're sort of out in the street. Once placed in the hotel rooms, it's made engaging with people a lot easier. It really supports engagement in a different way. So sort of lessons being learned on this as well.
Let's see. More questions came in throughout where I was here. I missed something here. Oh, question about the Family Justice Center is maybe a model for participating that might help address this issue. Chief?
The Family Justice Center recently opened last year, I believe, and we participated in that. It is a one-stop shop, and they will assist in some housing, but it's not a homeless shelter. So, say a single mom goes there with children, they work with the county resources to help them. And Chris, if you want to add anything to that, or Doug.
No, Chief, I think you covered it.
Okay.
Yeah, I don't have anything to add, Chief.
Okay, what is the success rate of people that have been in the county programs, provided housing, that have moved on to employment and self-supported housing? Any guess on that?
I don't have that data, but people who are enrolled in programs that we call full service partnerships, which are really wraparound intensive services, we actually do look at all of those factors about being sheltered, unsheltered, being employed, unemployed, hospitalization, et cetera. So we go back a few years and we go forward a few years. I don't have that data right now, but I could get some specific to those programs. Lavonna, do you have anything?
Well, I don't have it offhand, but I did just put a link in the chat to our annual report, which will be able to answer sort of our success rate in moving people into permanent housing for the most recent year. And so you most certainly can take a look at that data. I apologize, I don't have it on hand on top of my head, but I did put the link.
They're great questions.
Yeah.
Perfect.
And maybe one more here. It looks like oh, I just lost it. Well, anyway, good questions. Well, let's wrap it up at this point. Any other closing comments by any one of the panelists?
I would like to just add, one, thank you so much. I do appreciate open dialogue like this, and anytime cities invite myself in, and I'm sure Suzanne feels the same way. It really is a privilege to be able to talk to community members that we don't often enough get an opportunity to speak with. So that is always a real treat for me. And I wanted to also just share that it seems like there are a few questions regarding sort of pit count methodology that we can't get into right now, but I will say that you can go onto our website and take a look at our pit count report. The methodology is spelled out there, and it's a methodology that is used across the country for point in time count. So I will most certainly drop that link to our full point in time count as well, and you can just take this opportunity to read the methodology there. But thank you for the invitation. I really appreciate it.
I very much ditto all that Lavonna just said. It's really great to work with all of you and be part of this. And I think when we started talking about the importance of, we're all public entities, right? We all have limited resources, and the more we partner and work together, we maximize what we can do together. So that was a really nice part of this conversation also. So thank you for that.
No, I would just thank Dr. Tavano and Lavonna. You guys are doing some great work, and we enjoy partnering with you. And when we do have a success, that's what makes it all worth it. So I would just echo what the city manager said. We're just going to keep going out there and engaging our unsheltered and population that's suffering through this through their life, and keep it up. And that's all we can do. Keep up the fight. But thank you.
Okay, well, again, I want to thank you both for going to be solved overnight. We're going to keep at it. I could get cheesy and talk about the starfish analogy, but that works well here. If we save just one, it's worth the effort, right? So we keep doing what we can do. So this will be recorded, available online for future viewing and sharing with others. We want to continue to educate everybody about the resources that are available and keep encouraging progress in this effort. So again, thank you everyone for your participation. Really appreciate it.
Thank you. Good night, everyone.
Good
Good
night.
night.
Thank you.
Good night, everyone. Thank you.